everyone. It's Dr. Naomi Wolf, and I'm here with one of my heroes, truly one of the good guys, the angels for humanity, the half dozen or so, sometimes up to a dozen, but then it dwindles, but he's always in the remaining half dozen, standing at the gate, protecting our species, human beings, from truly demonic forces out
Yeah.
prowling around these days. It's Dr. Henry Ealy. And Dr. Ealy is the founder of Energetic Health Institute, and he's much more than that, as impressive as that is. He's also one of three leaders, advocates, along with State Senator Kim Thatcher and State Senator Dennis Linthicum of Oregon, who have led the charge in filing a grand jury demand against the CDC. So I know you've got big news for us. Tell us more, Dr. Ealy. What's the latest?
Well, the latest is that we finally got a response from them. And of course, we anticipated it was going to be a motion to dismiss, which it is. But the motion to dismiss was number one, filed late. So we do have in the works a motion for a judgment, a default judgment. We may or may not get that. You'll never know, right? But we also saw in there that they're arguing on the same principles that they've argued everything, lack of standing. And we
Hmm.
actually are going to be able to thwart that immediately. They also may have to, I can't tell you how many typos were in this, were in their response. So clearly
Sad.
it was panicked, right? And, but what was really interesting was they said that we didn't process serve the former CDC director, Robert Redfield, right? And
Oh, they're throwing someone else under the bus.
right. And so what we said was, well, actually we did. Here's our affidavit. His wife actually signed for it, which is proof of service,
Right.
and she did so at her home that he owns. So we have so many avenues now to attack their motion to dismiss, and we're going to be filing it on September 12th. So right now, between now and September 12th, it's all about getting the call to action out. We have a great campaign in conjunction with Stand for Health Freedom to get people, if you agree with the call for a grand jury investigation, you can sign on to the petition, say, I support this. And that's something we're going to get all those numbers. We're at about 150,000 right now, but we want to get over 1 million. And then
Wow.
we want to share that with the judge because we have to show
Guys.
this.
Yeah.
There's significant public interest in seeing a grand jury investigate these allegations of criminal data fraud and
Right.
willful misconduct.
Absolutely. And 150,000 is a huge number already. I mean,
Right.
you could pass bills in most states with that kind of
Right.
public support. And at a federal level, it's also hugely impressive. So congratulations. Well, everyone listening, go to where to sign up for to give you support.
Go to beyondthecon.com, and we're actually going to be putting that right on the homepage so you don't have to even sort or go anywhere. The instructions are right there, and we have everything laid out so that you can read the background on this, the timeline, a short little synopsis, a who, where, what, when kind of deal. Learn a little bit about myself and Senator Dennis Linthicum and Senator Kim Thatcher, but you can also download two important documents: the grand jury petition that was filed, and then questions and answers, FAQs about what a grand jury is, because most people don't know that this is our greatest sword that we have right now in the legal system.
Well, I want to know more about that, but can you give us in just a few sentences, and I know you've shared this with our audience before, but it's always good to remember or be reminded, what are you accusing the CDC of having done, and
Mhm.
who are the defendants? And also, I guess one other question before you answer that is, why don't you have standing? What reason do they give to claim that you don't have standing?
Outstanding. Well, let's tackle the first one. The first one is that we are alleging criminal data fraud and willful misconduct relative to death certificates. We've all heard out there that the death certificates are wrong. People got hit on a by a bus and called COVID death and so forth, right? We've all heard that. We've even seen with a new filing by one of our colleagues, John Bedouin, in Massachusetts. He got all the death certificates in
I
Massachusetts, and
love
he's
that.
showing he's
Yeah.
showing that people who died from the shot were counted as COVID deaths and not adverse event deaths.
People who died from the shot are counted as COVID
Are
deaths?
this We are seeing this everywhere, Naomi.
Oh
People
my
who died from the shot are being counted as COVID deaths. And
And
this is
what's the
huge.
evidence in the records that they died from the shot? It was shortly after the injection or
Right. There
anaphylaxis
was
or,
one that died within 5 minutes of getting the injection, but they called it a COVID
oh,
death.
that's the worst thing I've ever heard. Good God.
Right. So, and
Oh
this
my
was a little
God.
girl, right?
Oh
This is
my
a this was a little
God.
girl,
Oh my God. Oh my
right?
God.
So John got all this. Some angel behind the scenes gave him access to all of the death certificates. His team broke everything down. We're actually going to use some of his work to corroborate what we're saying in our response to their motion to dismiss. So what it comes down to is this: they cooked the books. They made a little sleight of hand and said, if you had pre-existing conditions and got COVID, or we think you got COVID, we're going to ignore the pre-existing conditions. Those aren't going to be considered cause of death. It's always going to be COVID. And that's the exact opposite thing that they do with every other cause of death. And what it allowed them to do, Naomi, was to hyperinflate the death count.
Mm,
So it looks like an emergency when in fact what the people really should have been listed as dying of is of diabetes or of heart failure or hypertension or the pre-existing condition, because it's always been that your oldest known pre-existing condition is the cause of death. An infection is what is termed as an initiating factor, but not a cause. And it's a little subtle distinction, but it's crucial when we talk about the death count for
mm,
COVID. So
mm.
what we're saying is that we have evidence to support a grand jury investigation, because what's happened, thanks to what Robert Redfield did, Alex Azar did, what Xavier Becerra and Rochelle Walensky continue to do, they've just adopted all of those early policies, so that makes them culpable. And what a little known man by the name of Brian Moyer, with the head of the National Vital Statistics Systems, what they all did was they changed how death certificates are reported, violated three federal laws in the process, did not open up public comment, did not seek oversight by the Office of Management and Budget, which
Mm,
sits under the president's jurisdiction,
mm.
and therefore went rogue. And in doing that simultaneously, this is where it gets crazy, Naomi. In doing that simultaneously, what they did was the HHS erected a structure for Medicare, Medicaid insurance fraud and that led to the misappropriation of $3.5 trillion of US taxpayer money throughout this supposed crisis, all based upon the sleight of hand of a death certificate.
Oh my God. Okay, so it sounds like you found the smoking gun. Let me restate one of the most salient things I think you just said. And you're answering a huge question, right? Because I lie awake nights going, how did so many doctors, hospital administrators, nurses, coroners go along with this? And what
Mhm,
was the mechanism basically to bribe them or bully them, or right? And so what
mhm.
you're saying is, if the death certificate says COVID death for this poor child, say, who
Right.
died of an injection, or some 80-year-old who died of diabetes,
Mhm.
then money that has been allocated by our federal government to go to what goes where?
So this is how they did it. On March 24th, 2020, the CDC and NVSS changed how death certificates reporting in
That you've
violation of federal
explained
law,
to me.
right?
You've explained that they moved the
Right.
cause of death.
2 days later, the HHS says, okay, Medicare, Medicaid, we are going to make sure you get a much higher reimbursement, hospitals, doctor, if you just go along with listing everything as COVID. It's the most lucrative diagnosis that you can give is COVID. And now, if that person's hospitalized, you're going to make way more money. And if that
Oh,
person dies, we get to call it a COVID death. It's complicity,
oh
it's
my God.
coercion.
Now hold on, let me figure this out. Could that explain the many, many reports of patients being kind of starved, left
Yes.
without water,
Remdesivir
kept
use,
from their
yes,
remdesivir use, kept from their loved ones seeing what's going on or advocating
yes.
for them, so that they would die, so that the
So they would
doctor.
die.
And
You
what kind of
cannot.
numbers? What kind of numbers are we looking
We
at
are
here?
talking about, and we have a certified death reporting clerk who's verified this. Remember, we've published papers on this that are peer reviewed, that have been reviewed by 9 attorneys, that have been reviewed by a judge for accuracy. USA Today tried to take us down and they couldn't, right? When we looked at this, We said the range of fraudulent death certificates is between 88.6% and
Oh, so
94.0%.
what do they get? Breaking it down on an individual level. Say I'm a doctor.
Okay.
My patient has diabetes. I help that patient get well and leave. I get X from Medicare versus I, starve my patient to death. I call it COVID. What do I get?
If you starve the patient to death and calling it COVID, your reimbursement for that same diabetic person is likely 3 to 6 times higher than what your reimbursement would have been otherwise. And when you think back to when the lockdowns went in, hospitals could only see COVID cases. So if they wanted to stay in business, they had to go along with it. And then there's no reason not to. It's free money
Oh my
coming in, right?
God. Oh
Remember
my
when
God.
remember when Senator Jensen
Oh my
exposed
God.
this, right?
Oh my God. Sort of, but it
Right.
kind of
He
got
he said
squashed.
he said you can get reimbursed up to $39,000 for the use of a ventilator, right?
That I remember.
Remember,
Yes.
that
Yes.
was Dr. Scott Jensen. And then the state, his licensing
Oh
board, because he
my
was a
God.
doctor too, came after him. He
Oh my
used our
God.
peer-reviewed paper to liberate himself. It worked.
Oh my
They
God.
couldn't refute what we said. Our paper has been used in legal cases. Our paper has been used now in this grand jury
No, I
petition.
believe you. I
It,
believe you.
it's just
I want to go back.
this
Right.
is the key.
Right. Okay. So where did how many trillions were allocated by HHS?
At least 3.5 trillion that we can confirm today.
And how did HHS allocate that without congressional oversight? Or did
It was
Congress?
an emergency.
Holy heck. Could that have gone all the way down to coroners? Because there have been precious few whistleblowers or people coming forward at that. Like, where did the money exactly go? Is it just hospitals and doctors who get
Okay,
reimbursed extra?
I'm going to be interviewing Ernest Ramirez. Many people watching know who Ernest Ramirez is. Sadly, he lost his son Ernesto Ramirez Jr. following getting the shot, right? The story when I was talking to Ernest was very simple. They knew that the shot caused his son's death. So what they did was they called him and said, if you change the death certificate to a COVID death,
Right,
we will give you more money,
right.
hush money, and we will pay for all funeral services,
You're
right?
answering a question that has been on my mind so much because so many people interviewed, especially about children's deaths from COVID or
Mhm.
deaths from COVID, don't sound like grieving parents. I'm not saying they're not grieving, but they say things like, thank God he had the vaccine. And,
Right.
if my child just died, that's, I would not be saying that.
Neither would I.
Or they say, please stop speculating about him
Right.
dying from the vaccine, or they just like, it just doesn't sound right. And or they give media interviews, and
Right.
about the death from COVID, and they say, I just want to make sure no other child dies from COVID. Get your child vaccinated. And again, maybe some
Right.
grieving parents would say that, but it just, you have that spider sense about things. So are you saying these poor parents are approached by whom and offered funeral expenses and money to call it a COVID death? Is that what you're saying?
We
Who
can't
approached?
say in every situation,
But in
but
this
we
one
can
case,
say we have specifically in this one case evidence of it. And if you think back in 2021, one of the policies that the federal government put out through all the money that was being just stolen from the American
right,
taxpayer was we will pay for all funeral costs for COVID
right.
deaths.
Oh,
See,
so they approach the grieving family and say, here's $10,000.
there's your incentive to say, yes,
They
please
get to go
change the
with that.
death certificate to a COVID death because
Oh
now
my
I don't have to pay
God.
for funeral services. I can't afford anyway because the economy's been tanked.
Right, right. Also, we don't know the number that they call, COVID, like funeral. Like it could be 20,000. We don't know, right? I
Right.
mean,
Well,
could.
it's at least $13,000 that we're aware of. At least
Oh my
$13,000 per
God.
family
Oh
we're
my
aware of.
God. That's where all the kids are dying of COVID
Right.
hype came from.
Right.
This is so catastrophic, but it makes perfect sense. Oh my God. And so, what's the role of so basically, the hospitals couldn't stay in business
Correct.
unless they killed off or said they killed off, or said a bunch of COVID deaths
Exactly.
took place.
Agree or die, right? Agree or go out of business. And to sweeten the pot, so you definitely want to agree, we're going to give you a substantially greater reimbursement through Medicare, Medicaid. And there's
Yeah.
this little caveat. If you don't have insurance, there was a provision put in through the HHS that you can qualify for Medicare, Medicaid at any age if you didn't have insurance. And who's
Oh,
paying for
so
that every time?
everyone get it has the option to get that money, and it's fine.
Everybody can get, all you have to do is say, I don't have
Yeah.
insurance, or you
Right.
really don't have insurance, and now you qualify for Medicare, Medicaid
It
because you
can
agreed to the diagnosis of COVID and all the
my
subsequent things with it.
God. This explains so much. And so this also probably is why doctors are being threatened, because all these
Exactly.
people took the money and they
Exactly.
killed all these patients.
Well, now what you, to get the doctors on board, because there's going to be a lot of doctors like me who believe in our Hippocratic oath, do no harm, right?
Right.
So how do you keep them silent? We're going to give you money. If you don't want that money and you speak up, we're going to threaten your license, like Dr. Peter McCullough.
Right.
We're going
Right.
to throw Dr. Pierre Corey. We're going to threaten your license. And if that doesn't work, we're going to make it such a nightmare for you to get your message out through all the censorship, all the text censorship and everything, and deplatforming.
Oh my God.
This is where you start looking at this and going, how is this not collusion? How is this not
Oh my God.
treasonous
Well, it's
against our
murder. I mean,
Constitution?
it's mass murder, among other
It
things,
is.
right?
It's murder. It's definitely murder for profit, in my professional opinion.
Oh my God. All right. Well, you've literally never said anything or written anything that did not prove to be true. So, and what you're saying fills in so many mysteries and explains so much. Like, even to this day, as we're seeing the harm surface about the vaccines, it's so strange that so many doctors are silent, or it's not strange at all, because they could
Mm,
all be tried for murder, or, you know,
right.
or starving people to death, or, the investigations would be massive. Well, now let's go to why the CDC claims you don't have standing.
Mhm.
Why don't you have standing?
Well, their argument was pretty incoherent, in my opinion, and very sloppy and unprofessional. And I'm not an attorney, but reading through it, they cited a lot of case law that wasn't
Mhm.
relevant. So what they attempted to do was create a straw man argument and then argue the straw man that they were creating. And their
Gotcha.
argument basically amounted to, they tried to turn our grand jury petition, which is unprecedented. It's never been done before that we're aware of in case history, case law.
Right.
They tried to call it a Bevins claim, which it's not, and
What's
say
that?
that a Bevins claim is basically saying that you as a citizen can sue the government under civil. It's not a criminal issue, it's a civil issue, and you can sue for damages, but you have to express to the court what those damages are. We're still learning about it. We just got this response yesterday, so we're still learning
Wow.
about some of this as well.
And you
But
said they missed their deadline?
yeah, see, this is what's interesting. They made a motion for an extension of time, which happens often in cases, right?
So it's
And they,
not a motion to dismiss? It's a
this
motion.
initially, let's go back to like, I think this was June 27th. I might be off on the day, but it's in June. They make a motion to, for an extension of time, because they said they need 60 more days so that they can put together a motion to dismiss, right?
Mhm.
We argued against it. We said, we'll give them 21 days, but they don't need 60 days.
Mhm.
Judge agreed with them and said, no problem, take the 60 days. But what was interesting was they said specifically in their petition, to their motion for an extension of time, that we need until August 26th to respond.
Uh-huh.
So they set their own clock and
Right.
the judge granted it. They didn't file on August 26th. So
Huh.
we immediately filed a motion for a default judgment.
No. Okay. So
After we
they did
filed a
miss
motion for
their
that, then they filed their motion to dismiss, about 8 hours, 10 hours after that.
deadline. Hmm. Hmm.
So, they're going for a motion to, they're trying to act like the rules of the court don't apply to them,
Wow.
and that we should be thrown out for lack of standing. Really? Two state
Right.
senators and a doctor in good
Right.
standing with
Unbelievable.
peer-reviewed papers should be thrown
Unbelievable.
out.
Okay,
Okay?
gotcha. And so what's the next step? Sadly, we only have a few minutes.
Of course, of course. Well, our next step is public support. We want to now finally get this out to everyone far and wide in the country.
Right.
We've partnered with Stand for Health Freedom, and we have a petition. We have our petition there where you can sign in support of it and say, I support this. I want the courts to know that I agree that this should be investigated by a grand jury. And when we get that number, we have until September 12th, because September 12th, we have to file our response. And I want to
Okay.
take all those
Yes.
numbers and say to the court, there's over 1 million Americans that agree
Right.
that this needs to be investigated. What say you now, Your Honor?
Gotcha. So they filed a motion to dismiss, and you've got till September 12th to respond and
Mhm.
show 1 million people saying, no, 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 you don't get away with this so easily. And they want you to include Redfield. Am I understanding that
Well,
correct?
they want to take him out because he's the linchpin. He actually signed off on the document that violated federal laws, and we have his
Oh,
signature on it.
uh,
So if they can get him removed from the case,
right.
then they stand a better chance of winning.
Nice.
But if
Yeah,
we keep him on, they're going to lose. And it may not be in this initial ruling. We might have to appeal. We might get a bad ruling and have to appeal. What we're
right.
telling everybody is the most important thing in this fight is to have a card to play, and we always have a card to play. We're going to keep playing them all the way until we get to victory.
Awesome. Well, this is an incredible, eye-opening discussion, but I don't have any reason not to believe you, as usual. People who want to help you, and I encourage everyone to help Dr. Ealy and the brave state senators Linthicum and Thatcher uh, push the ball forward on September 12th. Again, go to beyondthecon.com and add your support there. Send donations, please, because this is all expensive
Mhm.
and resource intensive. And, once again, just I could talk to you all day long, but just thank you so much for being one of that, 6 to 10 Americans left at the gates, keeping us all headed in the right direction in the face of what looks like the biggest mass murder in history. I mean,
Amen.
yeah,
Naomi, thank
thank
you
you.
so much for having me, and thank you for everything you're doing as well. I'm such a big fan, and I love everything that you're doing for our
Well, it's an
country.
honor to be in the trenches together. Take care, Dr. Ealy, and best of luck to you and your colleagues.
Thank you.
Everyone, it's Naomi Wolf of Daily Clout, and I am asking you to please, if you like the video you just saw, support us, become a member, donate. You can send checks to P.O. Box 24, Millerton, New York, 12546, or go to Daily Clout, DAILYCLOUT, become a member or donate. Thank you so much for your support. Every penny goes for paying our hardworking staff, paying hosting costs, and paying our lawyers who have been leading the fight to keep you safe and free, to keep the Constitution safe and to keep you free. Thank you so much.